I think, first of all, thank you. It's a great privilege. If anybody in public health hears the word malaria, it's because of its excellence. You are the beacon of health education, both in clinical and public health for Africa, and that's how I knew it. I'm also privileged to see some old friends from 25 years ago when I had an interaction with Makareri earlier in another function. The reason I call myself a troublemaker is because I take it a point to try to challenge someone's conscience, and that is the most troubling thing. What I try to challenge my partners, my colleagues, and those who are working with me, whether it's being government or partners, is can they go to bed in the evening and sleep well by saying we have done our best for the day? And that should be for the people we are serving. And that is a troubling question for everyone. That's why I'm a troublemaker. And that's what I would like to ask you as students and academics to say, okay, I am here. Have I done my duty to advance the health of the people? And if you ask that question, and if you have that answer, or at least start thinking about how to make it happen, you are my partner. You are the partner to health. So let me go back to the topic I'm asked to discuss. It's basically, I'll try to rush through because we have only 1 hour. I'll try just to give a glimpse of what WHO is and then go into the National Health Sector Development Plan, because that is the basis for our prioritization in Uganda for WHO. So, and then I would go into the topic of what we call the country cooperation strategies and the new approach which WHO is taking in terms of development, finally finishing it with what the country priorities is. And throughout, I would like you to ask yourself, where is my role and how can we advance it through academics, through research, through taking the issue of public health into the next level. WHO is a multilateral membership intergovernmental organization which has been formed in 1948. And it is where I call diplomacy meets public health. And it is the only public health organization which has the mandate to coordinate international health. In a way, ensuring that member states take the responsibility clearly and deliver. It was established, it was initiated in 1946, although member states ratified the Constitution. The right quorum was met on April 7, 1948. That's why April 7 is considered our birthday and the World Health Day, which we celebrate every year. And this year we'll celebrate it with universal health coverage as our motto. There are other specialized agencies which have their own membership, and including ILO, FAO, UNESCO, and World Bank, which makes us different from what we call the UN proper, which is under the Secretary General, which includes World Food Program, UNICEF, and so forth. So the specialized, maybe in another time I will explain what the difference is. And believe it or not, at one time our flag was yellow. And you would wonder why. Because before all this blue thing comes with the UN, even in the pre-modernization time, when a ship has an epidemic, it puts up a yellow flag as a quarantine mark So the first emblem and the first flag of WHO took that, but later on, after our Memorandum of Understanding with the United Nations, we have to change it to blue. The next two slides, I'll just leave it for you here, but it tells you also WHO as an organization is not only 70 years old, because the remnants of it, like the Pan American Health Organization, has been there since 1902. And the Office of International Health, the Hygiene Publique, which is the European version of an association of member states for public health, has been there since 1907. It's from those organizations in the 1948 that this World Health Organization is formed. And the contribution of Africa was through the Egypt Sanitary and Maritime and Quarantine Board when WHO was formed. It goes further into elaborating that WHO is also unique because it has a unique governance. It is the only organization where the regions have a governing body and the regional directors are elected, not appointed. So we are in a way an autonomous regional bodies which has come together to form the Global World Health Organization. So there is an elected Director General as well as an elected regional directors by member states. So that makes WHO more closer to its member states in addressing issues. So we have our own geography as well. So if anybody is in geography, they would be very much surprised that we have divided the world in a different way. And it has a political reasons. The Americas are because the Pan American Organization considers both Americas in the same association. In Africa, the Sub-Saharan Africa and the Northern Africa were divided because of the language and other reasons. So the Maghrebs were able to join the Middle East, forming the Middle East, which is based in Cairo. The African is based in Brazzaville. The Southeast Asia, which is for the Anglophone British colonies of Asia, is in Delhi, and then the Western Pacific in Philippines, and Europe is in Copenhagen. So each of these federations form the organization. So I hope that gives you a bit about WHO. What do we do? Our main responsibility is to support the national health agenda. And in Uganda, our main tool to see what are the country priorities is the health sector development plan. And in the case of Uganda, we have the 2016 to 20. And if we look at it for those, if you haven't seen it, the goal is focusing on universal health coverage, and also what is unique is it's not only looking to the health, but making people productive. So it has a component of economics in it. Prosperity is important for health in the case as indicated in the goal of the Health Sector Development Plan for Uganda. And the objectives are equitable, safe, and sustainable health services, ensuring the financial risk protection for the population, including key determinants of health, which includes the issues of non-communicable and social determinants, and ensuring that health sector competitiveness in the region. So it's not only looking into what health is, but health as a factor for productivity, as well as health as an economical power, to ensure that it also generates income. And the outcomes are clear. Reduce the preventable mortality and morbidity. Ensure that we address the social determinants of health. Non-communicable disease, decrease the risks of non-communicable disease as well as decrease the burden of communicable disease. So the point is, our focus might not be on reducing non-communicable disease, because the best way is to reduce them is through reducing the risks which the population is going through. And the the Health Sector Development Plan also clearly shows where the investment areas should be: governance, service delivery, health information, financing, health products and technologies, health workforce and infrastructure. We can debate where the emphasis could be, but at least we are sure all the necessary factors are there to ensure that health is addressed in Uganda. And the desired outputs is better access, better quality of care, increased demand, because you can't create a system, but unless you are able to ensure the population demands it, gets the services because of other factors like economics or access or knowledge, then those services will not be useful for you. And make sure this development plan also looks into how to be better in effectiveness, and the factors of equity is also addressed here. So why did I say that? Because the topic you gave me is to tell you what WHO does. So looking into this, we have a mechanism known as country cooperation strategy. And that country cooperation strategy looks into the national health plan, the national development plan, what are the international commitments, and it also looks into what is WHO's commitment, because we have a commitment to ensure that we deliver on attainment of all people the highest possible level of health. And all of you know the health definition goes beyond a physical, mental well-being. It also goes into social aspects of it. So to deliver health in all these regions, and we have 150 country offices, to deliver on all this, we would have to depend on knowing and aligning ourselves with the national plan. And this wasn't the normal thing. We used to do a 2-year plan, but when in the 2000 early, member states asked us, why are you planning 2 years, Anand? Why don't you plan for a longer time? So the decision was to align ourselves with the National Health Plan, which is usually a 5-year, which will give us a clear goal. And since then, we do what we call, as I said, country cooperation strategy, which is not only with the government. We come to the academics, we come to the NGOs, we come to the other UN agencies, to the other ministries to see how do we ensure to deliver on health in a country. And in Uganda, this process was done between 2014 and 15 to come up with the strategy for 2016 to 20, which is what is driving our priority currently. And there are a number of strategic priorities identified in this. The first strategic priority is health security, where our emphasis is on emergency, on diseases which have an international health regulation implications. These are diseases when, if they occur like Ebola, because of their effect on other countries and globally, we have an obligation to ensure we have the capacity to detect them, to contain them, and also the capacity to address them. And for those kind of capacities, we have to build what we know as core competencies for the country. So our first commitment is to ensure that Uganda can detect, inform, contain, treat, and prevent those kind of diseases. And those include plague, yellow fever, a number of them, Ebola, cholera, and so forth. So that is important. And for that, what we use is the integrated disease surveillance system, which is throughout the country. And we support the ministry and partners to ensure that we have this integrated disease surveillance and reporting system. That's our part one of our strategic priority one. The second focus area is emergencies, natural or man-made disasters, whether it's refugees, flood, and so forth. We have to address them because these are also issues of highest importance based on the disease patterns for Uganda. And the third is polio. Polio is interesting because we have invested billions of dollars trying to contain polio now to the last areas in Pakistan and Afghanistan. But if one polio case comes, or in another continent, all that investment is going to be wasted. So our vigilance in containing polio, using our integrated disease surveillance system, and further investment is also a priority because we don't want to be the ones which is pulling back the whole world from eradicating polio. Our second strategic priority is the health system to be effective, equitable, and to deliver quality service. And this involves working on policies, human resource for health, ensuring health financing, and increased access. It also goes in relation to the priorities and the goals which we are talking from the ministry. The second focal area is if you are not registered and if you don't have your information, you don't exist. So ensuring civil registration and health information working with civil registration is important. So that is our bedrock for our health systems as well. Strengthening health information is important. But we also have to make sure that the civil registry and vital statistics is kept at the best. The third focal area in this health system approach is improving access to quality medicine and technologies and ensuring their rational use. The third is our usual problem, the communicable disease. And here also we are focusing not only on HIV, TB, malaria, and hepatitis, but we also have to focus on neglected diseases, and especially we are in a different position because there are diseases, neglected diseases like in our neighborhood and in our area which has been eliminated, and we don't want them to come back. So we are also a very big, an important player in ensuring these neglected diseases are eliminated. The fourth priority is looking at multi-sectoral action to address the reproductive, maternal, neonatal, child, and adolescent health, as well as the social determinants of health, environment, and this is an ever challenging aspect because multi-sectoral coordination is not easy. And that's where probably sometimes we come as a neutral broker between ministries and civil societies to ensure that we have a goal to fulfill. And that's where part of my troublemaking comes, ensuring that bringing different partners to talk to each other. NCD, Non Communicable Disease, as I said, no nation in the world can afford to address non-communicable disease by putting money to it, by trying to treat it, because it's damn expensive. Whether it's the Nordics, whether it's the poorest nations we can think of, all of them have a problem because they can't contain the cost of non-communicable disease. The reason is because they are approaching it from curative point of view. What we have to do, you as public health professionals have to do, is to bring us back, to ask us that question: where is primary health care? Where is prevention? Where is health promotion? So our role there is to promote primary health care, addressing the risks, fighting the tobacco companies, fighting the alcohol producers, fighting the sugar drinks and fast foods, to ensure that we decrease the risks. There are movements in other parts of the country, of the world, which we bring the experience. For example, if Uganda wants to go into banning or increasing the tax on alcohol or on sugars. We are already doing something in tobacco, but we have to look into the other aspects of it. Or promoting physical education. Everything doesn't have to be with a stick. Sometimes it's also us to contribute to the ensuring that we have better health, which is the physical education, physical activities, and good diets and balanced lives. So this is it. So what's new I'm bringing in? So this is, we can say that, okay, you are trying to support in a different way what the national budget. That's my major job. But we are also in a very unique time this year, because we got a new director general and he wants to reshuffle things. For the first time, we were asked, what is the goal? Okay, you do all this, but can you quantify the goal? So he says, or the new World Health Assembly says, okay, the vision is clear. We want a world where all people attain the highest possible standard of health. That's part of our constitution. But how? And the answer was, we should promote health. We should keep the world safe, and we should serve the vulnerable. It is a typical political slogan, but it brings us together. Because for the first time, we are asked to define it based on the SDGs. As you know, the SDGs has 17 separate objectives, 169 targets, and they are agreed with all member states, and they are going to be there for 15 years. But one thing is important in the SDGs. If you really look at the targets, at the end of the day, it's the human which matters. It's the person, it's the family which matters, which makes, as I said in this one, health, although it's SDG 3, is a test and is central in ensuring that the other SDGs are delivered. So this became our direction for our new general program of work, which will direct us for the next 5 years globally for WHO. And what does that mean is this strategic priority also asks us, what do you mean when you say promote health? Because that is basically universal health coverage. We said we will make sure that 1 billion people will have a better coverage within the next 5 years. And this is not a commitment of only WHO, it's a commitment of member states, countries, all our partners in WHO. We'll make sure that when we said keep the world safe, what we meant is that for various reasons, there are emergencies which are making the health of more than 1 billion people at risk. At least we'll make sure to keep the safety of 1 billion people of those. And we also say that the vulnerable is getting more disease, more malaria, more tobacco, more TB, more malnutrition. We have to also contribute to the health of an additional 1 billion people. But you are going to ask me, is it going to be 3 billion people? I would say not necessarily. So, when you really look at it, some of the people in emergency situation are the same people who doesn't have access to health. So, we can't say we are targeting 3 billion, but we can say we are targeting 3 billion, because in actual numbers, it will be less than 3 billion people. By saying that and putting a figure to the people we target, we hope we will put equity in the calculation of what we have to deliver. And we are also committed that it's not in Geneva that we deliver health, it's in the countries. So we have to make sure more resources are there in the countries and more activities in countries. And that's why the new, if some of you might have read, at the beginning of this month, also the Director General and the regional directors went into a transformation agenda where they are asking me and every one of us in the organization saying, you have to account. You can't tell me that you are delivering health by conducting meetings. What does that meeting mean? What is the result? Because the result is the only thing which we can measure. And that's why the goals are important. Okay, and that works well with what is WHO's core functions. We have 6 core functions. Somehow it doesn't want you to see the core functions. So, our first core functions, which is given by the member states to us, is to provide leadership on matters critical to health and engage in partnership where joint action is needed. This is a typical politician's word. What does it mean? We have to make sure that there is health coordination where there is an emergency. We have to make sure that the right of the people are addressed when governments are discussing intellectual property, that it is not only for profit. That kind of leadership is required from WHO. And that, when we can't do it, please remind us. The second is shaping the research agenda. All of us, especially this is relevant to you, the academics. All of us are probably looking on, yes, we are doing a lot of research. But what are some of the research which have a global implication? Where is the trend? How do we make sure we bring all the scientists together so that they tell us this is the knowledge which is lacking? Because the organization depends, being a knowledge organization, it has to also look into what is the research agendas so that we can work with institutes to address a global knowledge gap. The third is setting norms and standards. I think that doesn't need an explanation. If everybody decided to do a measurement of height in a different way, you can imagine what a mess we will be. But those are done through technical working groups, through experts' consultations. We bring the best of the world experts. Some of your professors are part of those working groups to tell us the best is this. So that should be the norm, and every country should follow that. It has soft aspects, it has hard aspects. Knowledge, for example, what should be the standards, what should be the measurements. It could also be hard things, like, is drugs safe? Is the research protocols followed? And so forth. These are the type of norms and standards which the organization has to fulfill or has to promote globally. But when you go to ethics, when you go to research or practice in medicine, another cardinal function is there, ensuring ethics and evidence-based policies. Ethics is important because we know what happens when ethics is not done. The powerful will abuse the less powerful. And ensuring that ethical standards in health, whether in medicine or public health, is there is another function we do. We take technical support and catalytic functions, for example, doing experiments, doing pilot projects to ensure that others have learned, and monitoring of health situations and informations. And there are different aspects which I could go maybe another time to tell you how all this functions. So, with this new priority for the next 5 years, Uganda's priorities in our discussion with civil societies and the government are this. In the first billion, our focus on the first billion is what we call addressing the ensuring universal health coverage. Our priorities will be improving access to quality essential health services. And this is also reflected in the National Health Sector Development Plan. Reducing number of people suffering from financial hardships, our support to the possible insurance scheme which Uganda is looking is trying to make sure that the financial catastrophe is not a deterrent for achieving health. And improving availability of essential medicine and technologies and vaccines are part of the priorities we are looking into. The next one is in emergencies. We have realized that emergencies has become a major deterrent for people health. So here we will look into preparedness, response, as well as looking into an all-hazard approach to emergencies. The last but not least is where we focus on determinants, or whether it's communicable or non-communicable diseases, as well as risk factors and well-being and policies related to that. So these are the three. So now we have the 8 priorities. But the most interesting, and I think the biggest, I would say, where we will engage has nothing to do with the 3 billion. I have just mentioned the 3 billion. And that is strengthening capacity for data and innovation. Without evidence, we cannot convince the politicians. We cannot convince the investors. Without evidence, we are in a dark place where we decide on lives of people. So that is also a major emphasis we want to do in the next 5 years. Generating evidence and ensuring our politicians, our decision makers are guided by that evidence and policies. And that is where you come also. I'll say one thing. For the academics, help us address where there is a gap. For students, for the youngster, it's your life. Challenge us. Where we go wrong, scream. I may be upset when you put a newspaper blaming me, I may be, but that's your life. Maybe it's my job, but it is your life. So as youngsters, as students, as public health cadres, make sure that what we do, what your governments does, what your civil societies does, makes sure that it delivers on the lives of people. Demand what is the result. Demand what is the change. And that will be my message. It's your health. You have to care for it more than I do. Thank you.